Okay, we're now live on Facebook.
Good morning, everybody, and welcome to this webinar focusing on PPE and infection control issues here at CUH. My name is Dr. Liam Brennan. I'm Deputy Medical Director here at the hospital, and over the past couple of years, I've also had, as part of my portfolio of responsibilities, infection control and PPE issues. I'm joined this morning by my colleagues, Dr. Jamie Whitehorn, consultant microbiologist and consultant in infectious diseases, and also Christine Moody, our lead infection control nurse with focus on COVID-19. It's been a while since we had one of these webinars focusing on PPE and infection control issues, but as we go into the winter, it seems timely to hold another one of these sessions and emphasize some of the key issues as we go into the winter period. So Dale, can I have the first slide, please? We'll go through a few slides now, and there will be an opportunity to take questions, some of which we've received already and some that we can receive live. So that's the introductory slide. So the next slide, please, Dale. So just to put this morning's session in context, the current situation is that you're all very well aware from the national media and from the daily bulletins here at the hospital that the third wave of the COVID-19 pandemic is well and truly in progress. We're seeing high levels of COVID-19 in our local communities, currently around 500 to 600,000 cases per 100,000, as high as we have seen since January, February time. And the number of COVID positive inpatients in the trust are the highest we have seen since February, currently around 60 cases. As you'll be aware, we have several wards closed due to COVID outbreaks, with around 120 or so beds closed to admissions because of COVID issues. And this is having a severe impact on our operational capacity. And as you will have seen, we are on a high level of alert at Opal 4, as we've seen from the daily bulletins. And that means that we've had to cancel a large amount of our elective activity, including a lot of our surgical inpatient work over the past week or so. Next slide, please. So just really to start off by reassuring you that compared to the really worrying times that we had in the first wave of the pandemic in April of last year, our PPE supplies remain robust. The national supply strategy is working extremely well, and a lot of that is due to the fact that a lot of our PPE is now UK sourced. As you can see from the table here, all of our major PPE supply areas categories are flagging as green. So we have no issues with PPE supply, and we do not anticipate that having any issues going into the winter period. We now have a more diverse range of FFP3 masks available to suit people's different face sizes and shapes. And the procurement team at the hospital are continuing to source some lines independently for us, including the reusable JSP masks that many of you have been wearing. And we continue to review the situation with regards to PPE with an executive-led task force that meets on a regular basis. Next slide, please. Now, many of you have been asking about the availability of transparent type 2 face masks in order to facilitate better communication with a range of us to meet a range of needs for both our patients and our staff, particularly those who have hearing difficulties and language difficulties. Currently, there are no transparent face mask types that have been credited for use in clinical areas. This is a deeply frustrating situation, and we share your frustration. And the Trust have been escalating the concerns to both national NHS and regulatory leadership. But we anticipate from some very positive communications we've had in recent days that the situation will change very shortly now. So we ask you to be patient while we resolve that situation. But just to emphasize, this is not a local problem. This is a national issue that we have been leading on and have been emphasizing to the national team. Next slide, please. Now, recently, we received a patient safety alert, which highlighted that in a very small number of cases, there was an increased risk of surgical and procedural site infection associated with the use of valved respiratory protective equipment. This includes some of the FFP3 masks that we use, along with JSP mask and the respiratory hoods that many of you have been wearing. And the valved FFP3 masks are shown on the slide at the bottom there, just for your information. The message for you is that valved respiratory protective equipment should not be used when working directly over a surgical field, either in operating theatres or as the primary operator performing a non-surgical invasive procedure, such as a central line insertion. In the vast majority of situations, a standard type 2 surgical face mask will suffice. But if the patient's COVID risk requires you to wear higher level of respiratory protective equipment, then a non-valved FFP3 mask is a suitable alternative. Now, if you are unable to be fit tested to a non-valved FFP3 mask, remembering that we have an increased range of those available, then a type 2 face mask can be worn over the exit valve on an valved FFP3 mask or a JSP mask to mitigate the risk of infection. If you have any queries about this situation, please contact our infection controlled nursing team on extension 217497. Thank you. I'll hand you over now to Chris Moody to take you through the next few slides.
The green areas.
Chris, I think we just lost you there just for a second. You might just want to start that slide again. Sorry.
That's absolutely fine. I've just unmuted. Okay, so welcome everybody. We wanted to talk through about PPE in green areas because there has been some changes nationally as well as locally over the last few months now. Clearly, since the pandemic started, we've gone through various phases of knowing what is good practice, what is maybe not as good as what we could do, and actually working our way through on a risk assessment basis and being aware that the PPE that we require is doing the job we need it to do. So nationally, there has been an updating guidance about not the need to wear your visors completely all the time when you're dealing with patients in the green area. And that's something as a trust that we've looked into and have taken over. And obviously this is done very much on a risk assessment basis. It's almost going back to how we were pre-COVID. So the need for visors is still there, very much so. If a patient is coughing and you suspect that they may have COVID, then you must wear your eye protection, your visor or your goggles when going and dealing with that patient. And the process for them to be screened for COVID then starts, whether that is taking the swab sample and taking them into a side room. So it's about protecting you, it's about protecting the surrounding area, and therefore making sure we're doing everything we safely can for those patients. However, it is absolutely acceptable for you to go in to see a patient with your mask on, do your hand hygiene as part of the 5 moments of hand hygiene that we talk about, and then talk to your patient when you're going to talk to them about their care, and you know, that is an absolutely perfectly acceptable example of what we should be doing. Clearly, if you're going to do patient physical care, then you do need to don your apron and gloves as we've always expected you to do so. And if you are going to be dealing with any body fluids that may splash into your face, then again, as we've always expected, that you should either don a pair of goggles or a visor. So that hasn't changed. And it's quite concerning to me that people have said that they haven't been able to get the visors on the wards and are readily available to everybody. There should be no need for that. Procurement does have, as you've seen before, the stock levels are good, and there should always be a stock level on every ward. If you do experience problems, please let me know, and we can take that forward. And procurement also do send these up and top up wards on a regular basis. There should be no reasons why you shouldn't be able to get hold of the stock that you require. Can you have next slide, please? So as I was saying before, we still do need to wear aprons and gloves when you're dealing with your patient day-to-day care. And it is very much about protecting your uniform and your clothes when you might become contaminated from body fluids. But when you take your apron and gloves off, you doff, as we say, and do your hand hygiene, then you've done everything you can to protect yourself from anything you may pick up at a patient's bedside and then go into the next one. And the key message here is not just about what you use to protect your uniform, but is about your good hand hygiene. You'll be surprised how much can be passed on without doing good hand hygiene. Please wear your eye protection, as I said before, if you require it, because you're dealing with blood or body contamination. And this is often in places where you might be taking off catheter bags or and taking them away into the sluice and need to deal with disposable fluids. You should put eye protection on at that point. Okay, next slide, please, Tony. So despite the changes that we've done within the green areas, amber areas and our red areas still very much remain the same. And as you can see, we still haven't taken down the scenario 1 posters. They are up in our clinical areas and asking you to still wear your mask and your visor. We occasionally may up the mask to an FFP3 if we feel that that is necessary at that point. But at the moment, most areas will be in a surgical fluid resistant mask and your visor and your scrubs. Next slide, please. Red areas, there's been no change and no step down in red areas at all. Again, it's about your eyewear, your FFP3 mask and your scrubs. And as you can see from the poster, putting your apron and gloves on ready to go. We have stopped the long sleeved all the way down to the wrists because we were aware that people weren't being able to do their hand hygiene appropriately when they moved from one patient to another. It was making it far more harder for people to do that. So we wanted to make it easy, and that is why we went with the short sleeve gowns and the apron and gloves again. If I hand over to the next person, please.
Hi, thank you, everyone. So I'm going to just go really reinforcing what Chris has already said about the importance of hand hygiene. So this is such an important thing to do for infection control and protecting our patients. So just to revise the WHO 5 moments, so hand hygiene should be performed using those WHO 5 moments and then after removing PPE. So before touching a patient, before any clean or aseptic procedure, after any exposure to body fluids, after touching a patient, or after touching a patient's surroundings or leaving their bed space. And also we really do encourage that other patients, the patients themselves, are also performing regular hand hygiene. This is just a way to protect patients and staff as well from infection. Can I have the next slide, please? So we also encourage patients to wear a fluid-resistant surgical mask as much as possible. And this should be when they're at their bed or sitting in their bed space. And this policy applies regardless of COVID infection status, just reflecting that we are aware that patients can be infected asymptomatically. And this is, again, this is a way we can protect patients and staff from COVID infection. There are obviously some exceptions to this. So children, women in labour, patients who are on oxygen therapy, or patients who are confused, delirious, or simply can't tolerate a mask. And there are obviously going to be many exceptions in the clinical areas, but if we are able to get a significant proportion of patients wearing masks, it does provide some protection to other patients and also staff as well. Please can I have the next slide. So what can you do as an individual to protect patients and colleagues? So I think we can all pay strict attention to performing hand hygiene and wearing the correct PPE. There's something we can all do. We can be really attentive to that, and that's what we can really reinforce in our clinical areas. We should be getting our COVID booster jabs. We should be taking part in the asymptomatic screening programme. We should be encouraging patients and visitors to wear face masks. And I think this is really important. We should be constructively challenging poor PPE or infection control practice when it's seen. And this is really to protect colleagues. It's not there to kind of blame or shame people. It's really to protect them. And also, if you receive any challenges about PPE practice, that should be accepted in a constructive and positive way, because it's been given with good intentions to try and protect you and your patients as well. And the other thing is to really keep thinking about COVID. So if a patient develops a fever, always think about COVID and send off a COVID test. And in this way, we can try and minimize the risk of COVID outbreaks in our clinical areas. Can I have the next slide, please? Thank you. So it's just time over to you for questions that we'll go through. Liam, I think you're muted.
There we go. Apologies, everybody. We thought after 2 years we'd been able to get this right on Zoom. So thank you for that, everybody, and thank you for those for that, Chris and Jamie. We've time for a few questions now. We've already had some received before we in advance of this morning's session. So if I just kick off by asking this question, so maybe ask Chris and Jamie would like to comment. Why was the guidance on use of visors on green wards changed with cases in the community increasing?
Okay, so it does seem quite difficult at this time when we are seeing the increase in cases rising. But with the double vaccination, and what we have seen is that actually most patients are not coming to us, or most people don't seem to be the symptomatic COVID that they were before. So before they would come in, they would be coughing, and the risk of potentially transferring the COVID in through the eyes was obviously greater. But we are seeing a lot more of our positive patients now who have been vaccinated. Some obviously haven't. There is a mix, but they're not showing those symptoms. They might just show a high fever, the sore throat and malaise, but they're not showing the coughing symptoms that we saw in the first couple of waves, and certainly what made us as a trust step up and try and make sure that everyone had visors available to them. So the risk of it being transferred is far less from person to person, and that has been shown in the literature and the data that we've been receiving, not just us but across the country. Is there anything you wanted to add to that, Jamie?
Well, I think just to reinforce the fact that we would advocate visors, as you were saying in your section of the talk, Chris, when patients do have respiratory symptoms, and in that situation, we'd still be saying they should be wearing eye protection as well as the other PPE for patients who are symptomatic. But for green patients who are asymptomatic, as Chris says, the risk is very, very low.
Thank you. I think we've covered this point, but I will just reiterate it. The question is there an issue on the availability of visors, as they do not seem to be readily available in all clinical areas? Just to really re-emphasise the point from the slide that I showed, there is no issue at all with visor supply or any other PPE aspects of any other PPE range across the trust. So they are all readily available. I think the answer is, if you go to an area and you need to wear any aspect of PPE that isn't, please speak to the nurse in charge, who should be able to access it for you. The next question is, can we clarify if visors, gloves and aprons should be worn in green areas when you are close to a patient, possibly up close and touching them, but not anticipating contamination?
So you would only wear your apron, gloves and visor if the patient was coughing and you suspect COVID, or if you are just going to do physical patient care. So if you're just going to talk to a patient, as I said before, you know, it's acceptable to gel as you go in to see your patient, with your mask on, talk to them. We still are encouraging people to have some distance from your patients. I know that is not always possible, but there's absolutely no reason why you would need to put your apron and gloves on unless you're going to do physical care for that patient.
Thanks. The next question, going on to another theme now, is about lateral flow testing. And as you know, we have been encouraging everybody to do lateral flow testing, encouraging our visitors to the trust to do that. And the question is, does this apply to all patients and accompanying adults also coming to outpatient clinics?
Sorry, shall I start with answering that? I think that I guess that we should be, the national guidance is that people should be having regular lateral flow tests anyway, as a way of protecting them and their workplaces, etc. And I think if they can time their regular lateral flow tests with their hospital visits, that's just a way of improving the safety to staff and other patients in the hospital. It's not something we can enforce, but it's something that we should be actively encouraging to all visitors to the clinical areas. And again, if people are symptomatic, they shouldn't be coming to the hospital at all. And that's really important to stress as well. I mean, obviously, if they're coming to an outpatient's appointment and they're symptomatic, that shouldn't be happening. But if they can have a lateral flow test before coming, it's an extra step that we can put in place to improve the safety to patients and staff.
Thank you. Another question now about mask wearing. Is there any advice on how we should respond to patients or accompanying adults who are not wearing masks and state that they are exempt from doing so? How would you advise that we tackle that situation?
So they should carry an exempt card. There is which they can download from the government website, but obviously not everyone may have done that. And all you can do is politely say, okay, can we try you with a visor? And if they refuse to do that, and that patient who requires them to be with them, then, you know, we are wearing masks, the patient is wearing masks, and we're doing everything we possibly can. So it will be things like that you will need to consider asking, are they unwell? Have you got any symptoms? You may have to do that symptom check, which I know that outpatients do with their patients coming in, just to check that, there are no one who's coming in with symptoms. And we will, if they have got symptoms and they still refuse to put a mask on, we will be politely asking them that they should really go. And I think that's all we can do. It's about a risk of a patient coming in who actually requires someone to come with them, and we do say that's absolutely fine. We don't stop people coming that require that support. However, we do have to balance that risk, and actually sometimes we may have to say quite nicely to them, we need you to go. There is a policy, just so that you may not all be aware, that does talk about patients that are coming in who do actually, who are refusing to wear a mask. It is on Merlin, and it goes through the risk assessment of whether it's more beneficial that the patient comes in and has their appointment, knowing that we are doing what we should do with our PPE, or can we do that appointment another way? Is there anything you wanted to add, Liam, on that?
No, I think you're right, Chris. I think all we can do is to ask, to politely challenge, to offer alternatives, and in specific situations where a patient is or a visitor is clearly symptomatic, we should politely ask them to not attend for the safety of others who are around them, and including the person they're accompanying, obviously.
Yeah.
Okay, I think they're all the questions. There was one other question around the transparent mask, but I think we've covered that in the presentation about their availability, and hopefully they will be coming soon. Just please bear with us. Dale, is there anything that's come through online that you'd like to ask us?
There are a few questions, but before we go through the questions, someone's asked if they can access this recording and slides after the session, and the answer is yes. It will be made available on the staff portal, and we'll be putting it in the staff bulletin as well once it's been uploaded, so everybody will be able to access that. So first question is, we're on level 1 in the ATC Surgical Services Management Office. No patient contact whatsoever, and we clean our office 3 or 4 times a day. Can you please confirm if we no longer have to wear masks within the office?
You absolutely do need to wear a mask if you are with other other members of staff who are in the office with you. The only exception to that is if you're in an office on your own with nobody else present, then you can take your mask off. But if there are other people present in the room with you, you should be wearing a mask at all times. Hopefully, Chris and Jamie, you'd agree with that approach.
Yes, absolutely.
Yeah. And I would like to say that this not just boils down to infection control. This is about being COVID secure, and there's a group that look at that and look at mitigation that they can do that will make life easier in an office for you.
Thank you. Next question is scenario 0. We are seeing an increasing number of patients coming to clinic and refusing to wear a mask. Please, can you advise how this should be managed? Is it something the patients should be challenged on at the main entrance and reception before presenting in the clinic room? In addition to that, is the bulletin advised we should be asking all patients coming to OPAs to lateral flow test prior to attending. Please, can you advise what we should be accepting as evidence for these results?
I think we've covered some of that question already in the comments that we've given about mask wearing, and Chris has already signposted everybody to the policy around those who decline. So I think look at that on Merlin, it is there and has been updated recently. What was the other bit of that, Dale? About
lateral flow
lateral flow testing. Yeah, we're not being so prescriptive as saying that people have to show evidence. I think this is something that we are asking our patients and visitors to do, but it would not be feasible for us to police this. I don't think that is a realistic expectation of either our clinic staff or of our security staff to expect them to do that at the front door.
Okay, thank you. And Fiona from Clinic 1A has said, are there any plans in place to remove the carpet in Clinic 1A and provide wipeable chairs in one of the waiting areas?
So I know about this. It is something that we were pushing, and I think COVID has probably overstepped everything that's was originally being pushed prior back in 2019. So Fiona, sorry, I'll pick that up with the states for you. Okay.
There we go. You heard it here.
Thank you, everybody. And Fiona says thank you as well. There's just one further query from Gabby, who was asking about sitting in an office wearing masks. She's just asked to clarify if that still stands, if we're sitting at a computer with distance whilst at a PC, could we remove it?
So
sorry, Chris, you go ahead, you answer, please.
I was just going to say that I think we are seeing increased numbers within our staff again, and you know we really did hit a good low over the summer, but with the increased prevalence, I think now is not the time to step down from wearing masks, even with the 2-metre distancing. And so I think on risk assessment currently, I think it's best to continue wearing your mask, and I think you'd agree with that, wouldn't you?
Certainly at the moment, I completely agree. I mean, the prevalence in the community is very, very high, and we've had outbreaks in office areas in the trust already, so we don't want that to be repeated.
And just remembering that if we get outbreaks, then obviously in an office space it will often be members of the same team, and if we take out a whole team, then that can have major implications clearly for the individuals, but also for the functioning of the organisation. So please, I know it's frustrating, but please, can you wear a mask at all times when you're in a room with other colleagues?
Thank you. Just one quick question that's just come through. Would the rapid flow test be acceptable to accept in hospital, even though doctors still ask for the COVID test done, but they're flag rated green? Can you state how the hospital will be able to improve on hospital beds and availability?
That's a big wide-ranging question. In terms of the use of lateral flow tests and using them in having a greater role for them within the organisation, we are currently looking at that to see where in specific situations lateral flow could be used within the organisation to facilitate patient flow and placement. So that is work in progress. We'll keep you updated on that. And what was the other bit to it, Dale? I'm sorry.
Can you say how the hospital will be able to improve on hospital beds and availability?
That is a huge issue for us at the moment. Clearly, we're seeing a conjunction of issues here. The number of COVID patients, although not huge compared to what we had in previous waves, is enough to destabilize the organization. That, as you will be very well aware, is also having seen a lot of pressure from non-COVID patients with non-COVID related illness presenting through the ED, on top of the fact that we're also trying to catch up with the backlog of patients from the previous waves. So this is a really, really difficult situation that the managerial team in the trust with clinical colleagues are trying to grapple with at the moment.
That was Stacey asking that question. She said, thank you. I work on Clinic 12 and this is a massive issue.
It is.
And that's
okay.
everything, I think.
Okay. Well, look. Well, thank you very much, everybody. I think we've had half an hour. Hopefully, everybody's found that to be a useful session. Thank you for joining this morning. Thank you for your questions. Thank you to both Jamie and Chris for your contributions this morning, and to Dale for facilitating it for us. This session will be available, as Dale has said, online for anybody who wants to watch it again or share with colleagues. And thank you very much indeed once again, and have a good day. Bye-bye for now.
Thank you.
Thank you.